these three syndromes, you say to yourself, well, there isn't much that's specific. And in fact, it's very, very common to see fevers, cough, or whatnot in not only coronavirus, but in the typical colds that we typically get, as well as the flu. And so it's very, very difficult to really base on symptoms alone to determine whether or not you've got COVID or not, and testing is going to be important. So there are certain individuals that are at higher risk of having really bad outcomes related to COVID. Now, everybody, as far as we can tell, short of the kids, are as susceptible to being infected as anybody else. But once you get infected, certain individuals have a higher risk of developing severe complications from COVID compared to others. And these are sort of the lists of the conditions that predispose an individual for high-risk complications. So one is older adults, individuals who are 60 to 65 years of age or older. And in fact, when you take a look at some of the early New York, New Jersey, and Connecticut data, 8 out of 10 people who actually died from COVID were over 65 years of age. But in addition to just simply being older, there are a number of comorbidities that have been identified to also impart increased risk for complications. So again, as I mentioned, these conditions increase your chance of having a severe outcome of COVID, but it doesn't necessarily increase your chance of getting COVID compared to someone without these conditions. So Dr. Park will probably talk a lot more about sort of the issues around cancer. Active cancer is known to be a risk for having more severe complications related to COVID. It's a little bit of a debate whether or not a prior history of cancer and not being actively treated with cancer is a risk. Cardiac conditions like heart failure and things of that sort, or chronic kidney disease. And in terms of the other lung sort of and pulmonary things, COPD, cystic fibrosis. There's some debate about whether asthma increases your risk of having more severe complications. And it seems that those individuals who have the allergic type of asthma are at less risk than those who have asthma that are non-allergic in nature. But then maybe as others have mentioned, diabetes, any sort of other comorbid condition that increases the susceptibility to being immunosuppressed or being compromised in some way or form to combat the virus.